Hello, I'm Cynthia Matossian, Dr. Matossian, and I have dry eyes as well. It's a very, very common disorder that right now is at epidemic proportions in the United States. About 30 million people have it, and I'm one of those. So fortunately, I am not symptomatic yet. I don't have pain in my eyes. I don't have the gritty feeling. My eyes don't feel tired. I see really well, and I want to keep that up. And therefore, I want to have a LipiFlow done so that I can maintain the health of my meibomian glands. And Dr. Sebastian Lesniak, our cornea specialist, is going to be performing this, and he'll let you know about these big words that I just used, meibomian glands and dry eye disease, and he will go over the details with you as I become the patient now.
Good afternoon, everyone. My name is Sebastian Lesniak. I'm an ophthalmologist here and a cornea specialist. And as Dr. Matossian mentioned, we're going to be performing a LipiFlow treatment today. So I'm going to go ahead and start by first anesthetizing the eye to eliminate any discomfort.
I'm going to put the chair back for Dr. Matossian.
And once the eyes are anesthetized, we're going to insert the patient activators. Which we have already prepared for insertion. Thank you.
And that's a very common numbing drop that we use all the time.
So this is the patient activator. It may look scary, but it's actually a very comfortable device, especially after the patient is anesthetized. I'm going to go ahead and insert these activators in Dr. Matossian's eyes. So look down, please. And now look up. There we go. And it's correctly inserted. I'm going to secure it with tape. To make sure that it doesn't slip out. And we're going to go ahead and insert the second activator into the left eye. And I want to remind everyone who's joining us that Dr. Matossian is very comfortable. Her eyes have been anesthetized. And just keep looking down. Okay. Here we go. We're in. I'm going to go ahead and secure this activator just like I did with the right one. I want to make sure that the lids are correctly positioned. And one more piece of tape will secure the two and keep them in the correct position. And we're going to go ahead and start the treatment. And during the treatment, I am going to explain to everyone the etiology or the cause of dry eye and how this treatment helps. What we see here, this is shown in Celsius. The temperature is slowly heating up the eyelids. The patient activators first heat up the eyelids to the precise temperature of 42.5 degrees Celsius or 108 degrees Fahrenheit. By heating up the eyelids, secretions that are obstructing the meibomian glands become more liquid and are ready to be expressed by the activators. So let's back up a little bit, and I would like to explain to everyone why we perform this treatment. Dry eye is a very common disease. It's a chronic disease which is at times very difficult to treat. Artificial tears are oftentimes inadequate, which a lot of you might have heard of as the first-line treatment. Research has found that up to 86% of dry eye is actually caused by meibomian gland dysfunction, and about 14% is caused by lack of tears or tear deficiency. So what is meibomian gland dysfunction? Meibomian gland dysfunction occurs when meibomian glands, which are found in the eyelids, become chronically obstructed. Meibomian glands produce lipids which are essential to a healthy tear film, and their purpose is to protect the tear film from rapid evaporation in between blinks. What we see here is a healthy structure of a meibomian gland, of a set of meibomian glands in the lower lid. We see that all the glands are there, nothing is missing, and the subsequent pictures show progressive gland dropout. This occurs from chronic obstruction of the glands. So for example, here we can see that some of the glands have deteriorated and are not there anymore. This is someone who's lost more glands, and this patient has essentially end-stage disease where most of the glands are missing. These glands cannot be regenerated, they do not come back, and once you reach this stage, dry eye becomes very severe. I want to go back to the treatment here that Dr. Matossian is currently undergoing. As you can see, the machine has finished up the process of warming up the eyelids and the meibomian glands, and the pulsations are starting to begin. So after 2 minutes of warm-up, the activators will begin to pulsate and try to squeeze out the secretions that are chronically obstructing the glands. And we will zoom in on the activators to actually show that pulsation. And the noise that you're hearing is pulsations. Going back to we'll come back to Dr. Matossian. As you can see, Dr. Matossian is very comfortable and is not experiencing a lot of discomfort. This is actually a very comfortable treatment, and our patients are placed in a very comfortable position. I wanted to talk a little bit more about the meibomian glands. So I explained the gland dropout from chronic obstruction, but we can also see that initially glands can be chronically dilated, and that can also be staged. These images are acquired using a system called LipiFlow, which uses infrared imaging to actually take photographs of the meibomian glands. And we'll actually go next door to our LipiFlow room to show you the technology that acquires these images. And I want to again focus your attention on the activators, because now we can really see the activators moving, squeezing the eyelids, and clearing the meibomian glands from chronic obstruction. And as the camera is zooming in on the activators, you can see the movement, pulsations, and the way the activators are massaging the eyelids. So about 5 minutes have gone by. We went through the initial stages of warming up the eyelids and first few minutes of the massage phase. We're going to go next door to our LipiFlow room where I will demonstrate the machine which acquires the images and can stage the the severity of meibomian gland dysfunction. So this is our LipiFlow system. As you can see, it is a sophisticated camera. The patient would sit in this chair, place their chin in this chin rest, and the operator acquires the images. Infrared technology is used to image the meibomian glands, and the result is these photographs. As I explained before, this is the inner surface of the eyelid, and these vertical lines are meibomian glands that are illuminated with infrared light. On this side we see slightly dilated glands, but more or less all of them are still there. This image, you can clearly see that this section has missing meibomian glands. These glands have deteriorated and cannot be regenerated. The eyelid cannot regenerate these glands. You can also see that some of these glands are chronically dilated and the ends are split open. That implies that they are chronically obstructed. And I again want to stress that chronic obstruction of these glands leads to gland dropout or disappearance, which these glands cannot be regenerated. And once you lose these glands, you're going to be deficient in the lipid layer in your tear film. The lipid layer, or the oily layer, protects your tear film from evaporation. And lack of that protective layer leads to dry eye. And researchers found that up to 86% of dry eye is caused by meibomian gland dysfunction. What I'd like to do now is we'll go back and check on Dr. Matossian and see how the treatment is progressing. So we're back in the treatment room, and we see that Dr. Matossian is very comfortable. The treatment we reached about 4 minutes left in the treatment phase, and we can perhaps ask Dr. Matossian how she's feeling so far.
It's very, very comfortable. It's almost like a spa-like treatment. I feel the warmth. It's pleasant warm. It's not hot. It doesn't burn. As you noticed, I had makeup on because I saw patients all day today. So you can have this procedure done even if you have makeup on. And then you feel your eyelids kind of being gently massaged. It is not a squeezing. It is not painful whatsoever. And these are sterile activators. They're used once and discarded. So these will never be used again. So they're sterile. It's a very, very specific treatment per patient and discarded. So it's super comfortable. Does not hurt at all.
Thank you for this update, Dr. Matossian. And as you can see, this treatment is going to be over in about 2 minutes and 40 seconds. In the meantime, I want to talk a little bit more about dry eye. As I mentioned before, dry eye can be divided into two main categories. Either tear deficiency dry eye, which is frequently caused by things such as Sjogren's syndrome. Sometimes people who have undergone radiation can also experience tear deficiency dry eye. But the more common type of dry eye is caused by meibomian gland dysfunction. And there were many different treatments in the past, but LipiFlow is the only FDA-cleared treatment at this time on the market. It is very safe. Most patients are very comfortable. They can go back to work the same day. We warn our patients that early in the first few days after the treatment, their eyes may actually feel a little drier, and that's because their meibomian glands have been expressed and massaged, and the oil has to be regenerated. But the whole purpose of this treatment is to reopen chronically obstructed glands. So the glands that are still there, that have not deteriorated, can continue to function and continue protecting the tears from rapid evaporation. If the oil layer is deficient, tears evaporate very quickly within seconds in between blinks, and that's when patients experience symptoms of dry eye. A lot of times patients will complain of tearing, and when I tell my patients that you have dry eye, they're very surprised. How could my eyes be dry if I'm tearing constantly? But tearing a lot of times is actually a sign of dryness. And looks like we're almost finished with the treatment. We have about less than 40 seconds on the timer here. And we're going to get ready to remove the activators.
And this treatment cannot be done with contact lenses in. So the contacts need to come out if it's a patient who wears contact lenses.
Precisely. But the contact lenses can be reinserted after the treatment is completed, and the patient can definitely go back to work and resume their normal activities that day.
And especially with contact lens wearers, those patients who are interested in staying in their contacts, but they're having some discomfort, having this done may help prolong their ability to wear contact lenses.
Precisely. So the treatment is done. It's been precisely 12 minutes. I'm going to proceed and remove these activators. And I'm being very careful not to cause any irritation to the eye. And this one is out. And the same process. Take the same steps on the left side. Again, we're just removing them very gently. And that's it. The treatment is completed.
And the eyes feel very comfortable. And there's absolutely no discomfort whatsoever. Feels great.
So we're ready to...
Excuse me. And I'll take a Kleenex to dry my eyes. There we go. It was great. Very comfortable.
Doctor, I'm going to put your seat up now.
Okay, thank you very much.
Here we go.
Perfect. Thank you, Dr. Lesniak.
Thank you all for watching. If anybody's interested, please let us know on Facebook or call us. Most of our doctors are trained to perform this treatment, and we'll gladly see you and evaluate your dry eye.